Good afternoon. That was the first time I've done our intro video, so I'm so excited that it actually worked today. So I'm Ricky Fairley, and this is Love Your Bones. Our co-host, Dr. Nicole, is a little under the weather today, but I have an amazing guest today who is going to be so awesome, and her name is Dr. Michele McDermott, and she is the Chief Medical Director for Bone for Amgen, right? One of our sponsor for this show, and Amgen's such an awesome partner, and I'm so excited to have you here with us, Dr. Michele. So say hi to our guests.
Hello, everyone. It's great to have you on. And I'm Michele McDermott, and I'm really happy to be here on the show today.
Great. And are you an endocrinologist? Is that what kind of doctor you are? Or?
Yes. I'm an endocrinologist, and endocrinologists focus on hormones. And but as a kind of a super specialized endocrinologist, I chose to focus on women's hormones because they're so interesting and important. And women have so many complicated health issues related to their hormones, as I know you all can relate to. And as part of that, I also focused on osteoporosis as a very important part of my career, practicing for 30 years before joining Amgen as the medical director for bone health, which is really all about osteoporosis prevention and care.
Great. Can we just start by defining what osteoporosis is? Because I think it's like the shrinking old lady disease. Like, can you just explain it to us?
You bet. And you're right. A lot of people think that it doesn't really affect you until you're old and kind of decrepit. But because women rely on estrogen, the main female hormone, to really do so many important things in our body: reproduction, our skin, our hair, even our brain function. When we go through menopause at around the age of 50 and the estrogen level drops because our ovaries aren't producing it anymore, our bones are affected by that, and the bones start to lose mineral. And that loss of mineral leads to weakening of the bones. And that's what causes osteoporosis. And osteoporosis is a bone condition in which there's more loss of structure of the bone. And that results in an increased chance of a bone breaking, even from something really minor, like falling in your living room or, tripping over your dog and falling down, and you could break your hip or wrist. So the bones are more fragile and you won't feel that. So osteoporosis is a disease we often call the silent disease because you can't feel your bones getting weaker and more susceptible to breaking.
Well, we wake up every morning and we stand up taking them for granted, taking our bones for granted, but just like other parts of our body, they're aging too, right? We don't even think about, we take them for granted. And I know, for Black women and Black people, there are a lot of health disparities about bone health, around screening, around treatment, around even improper rehabilitation. Can you speak to that a little bit? I know some of the numbers that we kind of found is that we're 8 to 20% less likely to be screened. We're 5 to 10% have lower treatment for, I don't know if anybody knows what a Dexa scan is, and all these things are happening with Black people that make it an even more scary disease, right? We're 30% higher odds of not receiving physical therapy after a fall. So can you speak to that a little bit, just how, it's different maybe?
Yes, absolutely. And, this is something we didn't really completely understand until recently, until some really important research was done to identify this important disparity. And it's pretty shocking. And it's really important for men and women to understand that if you're Black, that you are less likely to be talked with your physician about osteoporosis. Educated about what happens if you break a bone, why is that? Or to be educated that, you really need to get on treatment because the consequences of breaking a bone if you're Black are really more serious. There's a higher rate of dying. There's a higher rate of, not being able to go back to work. And that can lead to like just not being able to, take care of yourself financially or take care of your family, to do all the things that you were doing before to the same degree. So it's really important. I think that one of the reasons for this bias goes back to the fact that physically, Blacks have bigger bones and more dense bones. And because of that, it's thought, well, it's not important. But in fact, when a bone breaks, whether, a Black person starts out with stronger bones relative to a white person, it doesn't matter. Once the bone breaks, the same consequences occur. So there has been this inherent bias that maybe Black people won't have as many fractures. And that's true. The rate of fractures is not as high, but the consequences are far worse if a bone fracture does happen.
Wow. Yeah, I know. I'm going to read this thing I found. And this is actually Dr. Nicole, our co-host, research that she did a couple of years ago, but this is crazy, right? When measured by fracture type, Black women had significantly different 1 year post-fracture outcomes. So within a year of your fracture compared with white women, a 38% higher incidence of mortality. So Black women are 38% more likely to die within a year after a fracture. Oh my gosh. A 40% higher rate of debility, meaning you can't take care of yourself because you can't work. Or just not being able to take care of yourself, and a 185% higher rate of destitution, right? Isn't that crazy? Like, I guess we just can't, and that's because we're not being treated properly, because we're not getting physical therapy. Like, how do we even get there? Like, because people just aren't prepared for it? What do you think?
Yeah, I think that there's a lot of reasons. I think maybe part of it is that the consequences aren't recognized, and perhaps access to really good care and good care programs may not be there for a lot of Blacks who live in areas where perhaps, they don't have the best care. Perhaps it has to do with also, medical benefits, insurance, whether they're on the best Medicare plan, that kind of thing as well.
Yeah, I know. And that whole Medicare thing is so hard to navigate, so hard. But, I think I talked to you about this earlier, Dr. Michele, about my mom. My mom was this very vibrant woman. She was an elementary school principal. She didn't retire till she was 80. And so I know, right? She was very active in the community. She's a Lincoln, a Delta. She's the president of everything, and very politically oriented. She worked in Congressman Van Hollen's office for as long as he's been a senator. And she was very active, and all of a sudden, bam, she broke her bone. She fell in the kitchen, bringing food to the table, and literally broke her arm out of the socket. I mean, the pictures are horrible. And then she's like now 21 pins in her arm. But she also had other things going on, like COPD, which is very common with Black people. She smoked as a young person. She probably stopped about age 50, but it still damaged her lungs. But that was the beginning of her aging. I mean, because I never really saw my mother as an old person until all of a sudden she couldn't do anything for herself. And she got pneumonia after the surgery. She had 2 surgeries and was really incapacitated for about 6 months. And so I think she's an example of how it was a silent killer. I don't think she had ever had a Dexa scan before, right? And all of a sudden she had this horrible break, and it changed her life forever.
I mean, Ricky, your mom is just such an incredible example of how well we can live into an older age and how productive we can be. But even with, having been a smoker and having her lung disease, she, was living life to the fullest. She was working, she was productive. Right. And then boom, that fracture changed everything for her and for her family too. It's had an impact on you, right?
Oh my gosh, caregiving, whole nother thing. I had to move in with her. Yep, I had to move in with that.
And so maybe this is, we can use your mom's terrible, tragic, fracture to help, think about what can we look for? So we can think about what are the things that make us more susceptible, and this includes Black women and men too. Smoking is bad for bones, and so physicians should be asking women, Black women included, to get a bone density test if they've been a smoker, because that's harmful to bone. Asking about other risk factors. Diabetes is another example of a condition that's common among Blacks, and it causes damage to the bone, just like it causes damage to your vision, your kidneys, your skin. And so that's another important one. And then chronic kidney disease also damages. It has to do with, causing, susceptibility to fractures, and it's common in Blacks because of high blood pressure. So these are all things that doctors should be thinking about, but they may not be. So hopefully, you can be thinking about this and sharing it, with your loved ones, a member of your family or a friend, if you know that, they may be at risk, to ask for bone density. These are things that sometimes as women, we have to advocate for ourselves and also for our relatives, our loved ones as well.
Yeah, I know. And we all have had an experience, somebody in the family breaking a hip or breaking something, right? And I always wonder, why did the hip break? Was the hip, because it's probably because of osteoporosis, but we thought it was because they slipped on a step. But did they slip on the step because their bone was weak? You know what I mean? It's kind of this oxymoron of what really happened. And really it's caused by your bones, maybe not by the corner that you tripped on.
Ricky, that's absolutely right. We used to think, that, it's just a, clumsy fall. But we know now that anyone over the age of 50 who breaks a bone without significant trauma, like a car accident, something really major trauma. I'm talking about like falling, tripping over something, missing a step. Those are not traumatic events. Those happen day in and day out. And if a bone breaks in that kind of situation, that means there's something wrong with the bone. It shouldn't break. People fall and don't break bones when they trip and fall or miss a step. But if you do break, that means that there's underlying weakness of that bone, and that's osteoporosis. And that can be treated. That's the thing. There are medications that can make the bone stronger and prevent or at least reduce the chance of having more breaks. Which can happen. And I know, Ricky, you mentioned to me how concerned you are about your mom potentially having another fall, right? Yeah. Because if she hasn't, what do you think about that? What do you worry about there?
Yeah, she's an accident waiting to happen, as many old people are. My friends and I talk about this all the time. And it's so funny. She's now 89. Still very active and thriving, but we have a caregiver that drives her around, thank God, because I took her car away a couple of years ago, which was very traumatic, but I wasn't worried about her driving, Dr. Michele. I was worried about her getting out of the car and walking across a parking lot into the grocery store or into the mall or wherever she was going, because I didn't trust her ability to walk. You know what I mean? And even then, I've learned so much now from you and Lyndon about bone health that I didn't even think it was to worry about bone health, so that to make sure that she was able to get medication to keep her, like, at least maybe prevent something else from happening. I just thought she was shaky on her feet, you know what I mean? Because she had bad knees. But I think now, even when you have someone in your life that has had a fall, get the medication, make sure they're getting scanned, make sure they're getting care for those bones so that maybe you can prevent that additional fall from happening. Because I know the next one could take her out. I'm very blessed to have her at age 89, and she is very, pretty relatively healthy, but, it's happening with people at younger ages.
Ricky, you're really, really right to recognize the concern about a fall for your mom, another fall, because we know that, the majority of serious fractures like hip fractures, or if you think about falls, the most serious consequence of a fall is a broken bone. And so if you have a relative who is falling, it's really important to address that and to ask the physician, what needs to be done? Do they need physical therapy to, strengthen their limbs or get improved balance? Or do they need, something to, support, fix their shoes to be more even, or, whatever they need, a walker that they won't use, because right. These falls can really be devastating, as you recognize, Ricky, for your mom.
Yeah. And you know what? It's not even all old people, Dr. Michele. It starts at earlier ages, and I think that even just preparing yourself to know what your numbers are, to know, get that Dexa scan. I guess we're supposed to get it at the beginning of menopause. Like, when should you have your first Dexa scan?
Yes, yeah, that's a really great point. And I think it's important to understand that, as I mentioned, women start losing bone and density or, mineral in the bones really around the time of menopause or even a little bit before. So it's good to have an idea of where you are around the time of menopause. A lot of doctors, just don't think about that. They wait for symptoms or they wait for someone to complain about something. And since we don't have symptoms from bone loss, they don't always think about getting a bone density scan. But, if you have a family member who's had osteoporosis, broken bones, or you have other risk factors like smoking, or you're not very active, or you take medications that can be harmful to bone, like steroid medications, or you have rheumatoid arthritis, or you have diabetes or kidney disease. These are all reasons that you can get a bone density test, as a younger woman, and definitely should have one as you get older into your 60s. But yeah, absolutely, Ricky, that is so true. And prevention is better. We definitely want to address it before that first fracture happens, because once it happens, the consequences are serious and it's painful. And I'll just give you an example. When you mentioned the younger woman, one of my patients popped into mind, and this woman was 60. She was not very active. She was a school librarian, and so she was very sedentary, loved to read. She slipped in her living room while she was decorating her Christmas tree and just went down on the floor, wood floor. She broke her hip and she broke the opposite shoulder. So she was not, so she had to have surgery, and she was in a wheelchair for months and months and months. She couldn't use her arm. She was totally dependent on her partner. And then she lost more bone because she was not weight bearing. And when you walk and you do things with your bones respond by keeping them strong. And so we lose bone when we're not active. So a couple of lessons there. One is, if she'd had a bone density test, she would have known, and she could have been on treatment.
Taking medication, right?
Yeah. And then it's the whole thing of, once those fractures happen, things get worse.
Wow. Yeah. I had a neighbor, and she got a new puppy, and as the puppy got bigger, she couldn't handle this golden retriever. She's like in her 50s, and the dog saw another dog, took off and ran, and she fell, and she's been recovering still for a year. And so you don't even know the little things in your life that are going to cause something big to happen. So just being prepared for it. All right, tell me one more thing, and I know you have a hard stop today, but why are people shrinking? Why do you shrink when you get older?
Yeah,
I'm shrinking.
I have shrunk too. I'm right in there with you, and I'm a lot shorter than you, but so I don't want to shrink anymore. But so there are really two reasons. The worst reason is if you have osteoporosis and you have we call them compressions or compression fractures of the spine. So broken bones in the spine and the backbone aren't a crack like in your wrist. It's a smush. So if you think about a dried sponge and you were to press on it, that would compress, and that would cause height loss. But we also lose height because between the bones of the spine are discs. Everyone's heard of discs.
Yeah. That was breaking and hurting
I
people.
ruptured a disc.
Right.
Well, those are kind of these spongy cushions between the bones of the spine, and they will flatten. They would get harder just from aging and wear and tear, just using our backs, So as they compress, we lose height as well. So not everyone who's lost height has osteoporotic fractures. It's just, we have to check to see, because if you have an osteoporosis related compression fracture in your spine, you might not know it because it happens so gradually. And that's why losing height, when you go to the doctor and they measure you and you say, oh, whoa, I've lost 2 inches, that's the time for someone in that office to say, oh, we need to do a bone density test. And if they don't, you should say, hey, doctor, I want to know why I lost height. I want to get checked for osteoporosis.
Yeah. So let's do that if you like to measure yourselves. Get your grandkids to measure, get your kids to measure. And for cancer patients or cancer survivors like me, it's so critical from all the chemo that we've been through to get that Dexa scan, and I was getting Dexa scans, but they never explained to you what you're doing. That when you first get scanned for cancer, you just get the scan. You have no idea what the scans are. It took me till years later to understand exactly what that was. So for my cancer survivors, make sure you're getting your scans, like any other scans, you're getting them even after you've, sort of gone through the treatment. It's really important, right?
It's definitely important because women who've had breast cancer treatment are more susceptible because those treatments cause, even a lower level of estrogen compared to a woman who's just postmenopausal, and so bone loss occurs even faster. So women who have had breast cancer treated, with medications that block estrogen are more susceptible too.
Yeah. And, breast cancer is affecting so many young Black women that are way younger than me. So it's, the women under 35 get it at twice the rate of white women. So be healthy. So thank you so much. And we'll talk on our next show about kind of what you can do to prevent it. But we so appreciate you, Dr. Michele. But, it's all about nutrition and exercise. And you guys know you can't eat fried chicken and mac and cheese every day. Do the right thing by your body, right? Even though I want to. But thank you so much. You have been a jewel. We so appreciate you. We so appreciate our partnership with Amgen and all the work that you guys are doing to keep us healthy. So thank you. And please come back on our show.
I would love to. It's been a pleasure, Ricky. Thank you so much for having me.
All right. Have a blessed day. Breasty love. I have to say that anyway. Take care. Bye-bye. Bye, everyone.
Bye.
We'll be back in a month, first Sunday of every month on blackdoctor.org at 3 p.m. Eastern. Take care, everyone. Bye.
Bye.